day, ladies and gentlemen. You are welcome to another episode of your program. Let's talk about infertility openly. Today we'll be talking about a very important topic, a very common topic, uterine fibroids. Let me start by telling us what uterine fibroids are. Fibroids are abnormal growths in the womb of a woman. Fortunately, fibroids are not cancer, they're not cancerous. So they are easily treated. And they are very rarely life-threatening. But they can make life pretty uncomfortable depending on the symptoms that the person has. Up to 70% of women will have fibroids at some point in their lives. But the issue now is that some of them will have small fibroids, some will have big fibroids. Some will know they have fibroids, some will never know they have fibroids. Any 10 women in Africa, 7 of them will have fibroids. The commonest symptoms we have is heavy menstrual flow. So if my period is heavy, I may have fibroids. For some people, they may not have heavy periods, they just have painful periods. So painful menstrual flows also will suggest that there's fibroids. Then for some people, what they tend to experience, they don't have heavy periods, they don't have painful periods, but just notice their tummy is getting big. And then people ask them, "Oh, madam, I think you're pregnant," and they are not pregnant. Okay, so we have a category of people like that, progressive abdominal swelling. Then we have a small category of people in which they just have miscarriages, and it's because of the fibroids. Ultimately, the best way to make a diagnosis of fibroids is to have a scan done, an ultrasound scan. An ultrasound scan is very safe test, and they can tell the fibroids, can tell the size of the fibroids, can tell the location of the fibroids, and then we can take it from there. More often than not, if fibroids does not have symptoms, we just don't do anything about it. But if it has symptoms and is making the individual uncomfortable, usually we want to treat it. We have what we call medical treatments, in which case we use drugs to treat fibroids. And apart from that, we also have surgical treatments, in which case the fibroids are actually removed by surgery. Talking about the medical treatments are drugs that we can give, and the drugs will shrink the fibroids, number one. It will also reduce the symptoms of fibroids, number two. But the unfortunate thing is that if you are trying to get pregnant, medical treatment of fibroids is not advisable for you, because the same drugs that treat the fibroids, at the same time, it will prevent ovulation. And if it prevents ovulation, it will prevent conception. On the other hand, surgical treatment of fibroids is recommended. So we take out the fibroids and we leave the rest of the womb behind so that she can complete her family. Now, at times we have a person that has fibroids and she's completed her family and she wants to have surgery. In such an instance, we can actually take out the whole of the uterus and then that's all. Because like you probably guess, at times you take out fibroids and then it grows back. So the only thing that offers permanent solution to the issue of fibroids is taking out that womb completely. But we know that that is not practicable for people that have not completed their families. Many times I see people say, "Oh, it is this fibroids that is causing my delay in getting pregnant." This is rarely so, because at the end of the day, many times when you take out the fibroids, still the couple are not pregnant. So before we say the fibroid is the problem, let's look at more pertinent things. Let's check the fallopian tubes, are they open? Let's check the eggs, are they being released regularly? Let's also check the quality of the sperm. Let's check these major things before we say, "Oh, maybe it's the fibroids." Then you may also like to know that talking about removal of fibroids, there are two approaches to this also. So some people may want to have an open surgery in which they have an open surgery done, an incision is made about 10-15 centimeters done for the fibroid removal. At times you have what we call a laparoscopy, in which the surgery is removed through a small incision below the belly button. And for this, the person may not have to spend more than 2 days in the hospital, the risks are less, and everybody goes home on time and can get back to work on time. This is the bit you'll be able to take today. I really do hope you learned something from our discussion. Till we'll see you again, have a fantastic day.